widen fixed cost revenue base, the Aravind case study. Hospital prices, we know, have been spiraling. Across the world, hospital prices have actually been growing 2x the rate of inflation in that economy. And this has been happening for decades, right? So the question is there a way hospitals can remain profitable, beat the fixed cost dilemma, keep the prices affordable, and also deliver high quality? In response, we see hospital administrators trying to integrate services horizontally. We see them absorbing or cooperating with neighborhood clinics or other facilities. Basically, the underlying incentive or the underlying drive is the same. They want to increase scale and they want to spread fixed costs over a larger revenue base. Right? You also see recently private equity players that have investments in hospitals forcing them to merge so that they can leverage this merged volume, which is larger, and create market dominance and negotiate better rates. Now, this also means that the patients in that area may face higher premiums, larger copays. So you see all of these kinds of behavior today in the marketplace. It is true that the fixed costs of healthcare, the variable costs of healthcare have gone up. And, drugs have become more expensive, R&D costs have spiraled, the aging population, the chronic illnesses. So we understand all of this. But then there must be a way in which we can beat the fixed cost and still deliver high quality. This is where I want to introduce Aravind. The legendary eye care system started in 1976 by Dr. Govindappa Venkataswamy. Aravind today is probably the largest and the most renowned eye care provider globally. Aravind has performed over 9.4 million surgeries as on date, and the system handles close to 3.5 million outpatients annually. Those numbers are just mind-boggling. Their commitment to accessible eye care ensures that several scores of their patients receive high-quality treatment regardless of their ability to pay. I think they've understood how to beat the fixed cost, how to widen their revenue base, remain utterly affordable, and also provide some of the best clinical outcomes for some mind-boggling volume. Let's look a little bit into Aravind. Here are the headlines from Aravind Eye Care. Aravind has been able to forcefully drive down fixed costs by increasing productivity. 1,000 plus procedures get performed every day across Aravind facilities. The model is inspired by McDonald's, standardizing delivery at very high volumes. Another unique characteristic of the Aravind Eye Care system is the hyperutilization of the OTs, where you have multiple tables and multiple nursing teams. Doctors focus on diagnosis and surgery, and nurses are elevated to do the rest. Not only are the nurses elevated, Aravind has also elevated their technicians. And by hyperutilizing OTs, they also sweat their equipment. Imagine 9.3 million surgeries performed. Aravind single-handedly does, I think, close to what the entire NHS is probably doing for eye care for the population of UK.